The first vital sign to discuss is temperature. Accurate temperature measurements provide information about a patient's health status and guide clinical decisions made by the nurse. For example, an elevated temperature, referred to as a fever, can indicate the client is experiencing an infection. Body temperature is documented in degrees Celsius or Fahrenheit. There are several methods for measuring body temperature based on the client's developmental age, cognitive functioning, level of consciousness, health status, and agency policy. Common methods of temperature measurement include oral, axillary, tympanic, rectal, and temporal routes. Each of these routes is further discussed, and skills checklists are provided later in the module. When documenting a client's temperature, it is important to document the route used to obtain the temperature because of normal variations in temperature in different locations of the body. For example, axillary temperature can be 1 degree or more lower than an oral temperature. Normal temperature ranges are discussed later in this lesson. Oral temperature is taken in the mouth under the tongue. Normal oral temperature is 35.8 to 37.3 degrees Celsius, 96.4 to 99.1 degrees Fahrenheit. An oral thermometer is shown above. The device has blue coloring indicating its use as an oral or axillary thermometer, as opposed to a rectal thermometer that has red coloring. Oral temperature is reliable when it is obtained close to the sublingual artery at either side of the base of the tongue. Some factors can cause an inaccurate measurement using the oral route. For example, if the patient recently consumed a hot or cold food or beverage, chewed gum, or smoked prior to measurement, a falsely elevated or decreased reading may be obtained. Oral temperature should be taken 15 to 25 minutes following consumption of a hot or cold beverage or food, or 5 minutes after chewing gum or smoking. Axillary temperature is taken in the armpit. The axillary method is a minimally invasive way to measure temperature and is commonly used in children or in adults with impaired cognition who may not tolerate oral or tympanic routes. It uses the same electronic device as an oral thermometer, with blue coloring, but the probe is placed in the armpit. The axillary temperature can be as much as 1 degree lower than the oral temperature. See the image of a nursing assistant taking an axillary temperature. Tympanic temperature is taken using a device placed in the ear. It is more accurate than oral or axillary measurement, because the tympanic membrane in the ear shares the same artery that perfuses the hypothalamus, the part of the brain that regulates the body's temperature. The tympanic temperature is typically 0.3 to 0.6 degrees Celsius higher than an oral temperature. See the image of a tympanic thermometer. The tympanic method should not be used if the patient has a suspected ear infection. Rectal temperature is taken in the rectum. It is the most accurate measurement method, but is considered an invasive procedure. Some sources suggest its use only when other methods are not appropriate. However, when measuring infant temperature, it is considered a gold standard because of its accuracy. An adult requiring a rectal temperature should be placed in the Sims position, which will be discussed later in this course. The rectal temperature is usually 1 degree Celsius higher than oral temperature. A rectal thermometer has red coloring where the probe attaches to the device to distinguish it from an oral or axillary thermometer. See the image of a rectal thermometer. Temporal temperature is taken by using a device placed on the forehead. Temporal thermometers contain an infrared scanner that measures the heat on the surface of the skin resulting from blood moving through the temporal artery in the forehead. Temporal temperature is typically 0.5 degrees Fahrenheit, 0.3 degrees Celsius to 1 degree Fahrenheit, 0.6 degrees Celsius, lower than an oral temperature. It is a quick, non-invasive method, but accurate measurement is dependent on good contact with the skin and good placement on the forehead. The average body temperature is 98.6 degrees Fahrenheit, 37 degrees Celsius, but normal body temperature can range between 97 degrees Fahrenheit, 36.1 degrees Celsius, to 99 degrees Fahrenheit, 37.2 degrees Celsius, depending on the activity level or the time of day. Older adults have lower body temperatures, a reading of 96 degrees Fahrenheit, 36 degrees Celsius, is not unusual. The table above has average temperature ranges, according to the measurement method. In general, notify the nurse for temperatures greater than 38 degrees Celsius, 104 degrees Fahrenheit, because this indicates a fever.